makes her butt blend in. So we got to take that away.
And this is one of my favorite parts about what Trevor did to me, is that I didn't do a fat transfer to the butt, but now my butt has a defined starting point. So when I'm like, you know, checking myself out, the shape is so much more specified, you know, like you know where the butt is starting and you can see where it's ending, and it's like I didn't do anything to my butt, but my butt shape is
right.
definitely
Defined.
better. Yeah,
One
it's
definition.
defined.
Definition in the butt is the best.
I can show it to you if you want to.
This is where the magic happens.
This is a good view right here.
Yeah, that's pretty good.
That's awesome.
I did pretty much the same thing
Did
when he
you?
was doing
Did
lipo
you?
on me. I have all this video of me, yeah.
I think
Girl,
it's
what
the
are you doing?
same view
I'm
that I
getting
like.
liposuction right now.
And the butt emerges.
Someone said, oh my goodness. Are you getting your ass done? I guess you could call it that, right?
I'm working that ass. Is that bad? Is that inappropriate?
It's factual.
Okay. Live video.
Maybe some people can relate.
Right?
Oh man. Doesn't that hurt? Not right now, it doesn't. I haven't been live on Facebook in a minute, but it's getting up there.
Now, is it different that hers is really orange, or does it separate later?
Yeah, I don't.
So yeah, so see how it, you can see at the bottom, at the very bottom, there is a little bit of fluid. And so that's the fluid mixed with a little bit of blood. The fat itself is going to be yellow
Okay.
naturally. But anytime it mixes with blood, the blood is like dye, and it's going to change it, you know, it's going to change its color. So you'll go from yellow, depending on how much blood. If there's a little bit of blood, a couple of drops, it'll turn it orange. But the fact that it's still so orange, and I mean, there's so little blood loss right now, which is pretty incredible that we're sucking her fat out of her body. And
So it's like all fat, no blood.
Yeah, exactly.
Pretty much.
So you pretty much telling me I'm just like just fat.
Yeah, there's no blood.
No, it's not that you're just fat. It's just that what he's
Oh,
removing.
it's just fat,
yeah,
right.
so it
Okay,
means
that's
the
good.
medication's working really well on you.
Okay.
This is
Not
by
having
design.
any blood loss.
This is the way. it's
Someone
supposed
says,
to
how the hell are you smiling right now?
be. What did you say?
How the hell are you smiling right now?
You?
Yeah.
Because you're getting a nice ass and a waistline. I mean, how would you
I'm
not be
scared
smiling?
for you. How's your pain level? It feels like he's pinching me with something.
Can you just tell those people to stop being a wuss?
Yeah, really, seriously. How are you being so relaxed?
Were you relaxed before, when you first started?
No.
She was
I
like the
had-
most nervous person
I was so
ever.
scared. I was about to like run out.
Right.
Fight or flight.
Yeah. Is he sticking a rod in you?
And
Yeah.
You need to come back over on this side, Trevor, or Z, and see how the shape has changed already.
Let's see. Oh wow, look at that. It's already like a.
So where it was just more of a plateau from the level of the butt before, now he's sculpting it down.
Someone says, what kind of lipo is this? I've been looking into procedures.
So this is what we consider the tumescent technique, where we're doing local anesthesia. We're numbing only the fat layer. And the advantages are, as you can see, the patients can be awake. It completely eliminates general anesthesia. The recoveries are a lot easier. You get less bleeding, less complications, less side effects.
I'm shocked at how nice people are. Like, I don't think I've had a single mean comment. Like, I'm usually like the one to get the mean comments. Everyone's like, oh my God, what is this? I want this.
Right?
Did they do this procedure on your stomach as well? Yes.
So you guys are coming in a little bit late. We've already finished, or not finished, we've done most of the front of the stomach and one of the sides, and now we're working on the lower back. So this is what we call 360 lipo. So we're going 360 degrees all the way around the waistline to complete the job and get everything out. Yes, spare tire will be gone.
Instant results. Everyone keeps saying that.
So everybody wants, right? The
Right.
microwavable.
How long is the healing process?
So once the fat's gone, when she leaves today, the natural body's reaction is to swell up. So you're going to get some degree of swelling. You're going to get some degree of bruising. And all that's going to take time to heal. As your body heals, the swelling will come down. Now the results, as we said, you're going to get instant results in that you're going to be smaller immediately. But as the swelling goes away, those results kind of will continue to get better. And it'll continue to get better for almost a year. We're going to have to change those tags.
I think it's like taboo too, because not many people go live with this.
Right.
They'll post
Nobody
it on
does.
their like Snapchat, but they're not live with it, you know? Does that hurt? No, not at the moment. What's the location?
So we're located in Las Vegas area, Henderson to be exact. But it's about 20 minutes from the Las Vegas Strip, as well as the airport. So people that are flying in from out of state, we've made it really easy. And so you can really start to see this curvature forming here. And you can
Price.
see when we're pinching it, there's very little in there anymore. You know, before I was pinching a big chunk like that, and now there's next to nothing.
Lift your phone, we want to see. Someone said price. They want to know the price
Do
again.
you want me to hold it for you so
So
we can get a different
price,
view?
we charge $12.99 per area for liposuction and $2,000 for the fat transfer. And what you need, how many areas you need, is going to be dependent on the individual. So make sure you schedule your free consultation, and we'll put a link down in the comments down below, or you can call our office to schedule your free consultation, and those consultations can be done. Can you come closer so they can hear? Those consultations can be done over the phone or with the. They can be done over the phone with the use of pictures, or we can do them in person if you're local here in Vegas area. But about 70% of our patients are flying in from out of state. So we try to make that whole process easy for you, as well as the traveling process getting out here. And we have hotels that we recommend that you stay at. So we,
12 hours.
yeah, so we try to make it as easy as possible for you, you people coming from out of state. So don't be scared. I know there's lots of you that, like Tiffany, you may live in a small town where you don't really have people that are good at doing liposuction, or nobody gets it done very often. So yeah, so you don't want to go to somebody that doesn't know what they're doing. So it's important, that you go somewhere that specializes.
And you do nothing but that.
Right. So that, since all we do is liposuction, all I do every single day is suck fat out of people and stick it back in other places. But that's because I do that, I get a lot of experience, and I'm used to dealing with challenges. And so a lot of the issues that other practices might have, a lot of the issues that other doctors might have, we don't really have them because I've solved those problems already. I've had a lot of problems over the years and experience in doing this stuff, and we've made the proper adjustments already. So it's better for you people now that are coming in, and we're doing it the right way because we've done thousands and thousands of these procedures. Okay, let's go ahead and change it. All right, so we got 2 bags of fat already. You guys have any questions? Any questions?
She said, wow, and you weren't put to sleep.
I know, it would be hard if I were asleep.
Someone said cover it. I think they were talking about the fat. Do they do this in Iowa, or is it just there? Can health insurance?
Okay, I'm sure that there is someone in Iowa that sucks fat out of people. However, do you want to go to the guy that does it once in a while, or do you want to go to the guy that does it all the time? So it's your choice. I'm sure you can find someone in Iowa, but good luck.
Want to say hello? Hi, guys.
Okay, and just like that, like an oil change.
Like an oil change. My back hurts. This is crazy amazing.
Come on that side again.
Someone said, this is the same place that Candy Lover got her lipo done.
Isn't that a coincidence?
Sure ever. Have you guys met the Schmidt?
How much does a typical bag weigh?
So so it comes out in a volume. The volume is about 2 liters, and so if you can calculate liters, the volume of liters to weight, it's 2.2 pounds per liter.
Of fat.
So 2.2 pounds times 2 liters, we're talking about 4.5 pounds.
If it's pure fat. So if it's part fluid,
Yeah, it'll
it's
be,
not,
yeah.
you know, there's some fluid weight in there too, and because the fluid goes to the bottom, the fluid weighs more than
Right.
the fat does because the fat's floating to the top. So it's an estimation.
Right. Cost of this, wondering if it's worth travel for it.
Turn on your side facing this way.
Okay.
The cost of traveling is, like I said, about 70% of our patients fly in from out of state. And the cost that you would get at a local place typically is substantially higher than what they're charging here. So it typically will make sense from the standpoint of cost to get the procedure with us as well as flying out here. And it's still usually cheaper for you.
She's saying, please tell me you're numb. Is it just local anesthetic?
No lab on abdomen, please.
What's that?
On abdomen.
Oh, can you go from the back side?
You go right? No, but I just don't, no.
I'm going to flip this around so I can see what I'm doing. Okay, so this is the beginning. This is behind you. This is what it looks like before we do this right side of her abdomen.
So we're going to be creating the hourglass figure here. And the lower back looks phenomenal already. No more back fat.
Southern people eat fat back.
It is a set price by how many areas you treat. It doesn't matter how much fat is taken out per area. Yeah, if Trevor was any more transparent, then we could see through him.
I think people like seeing it live.
Did I seeing it?
It's like seeing it live, you know, it shows it live.
Absolutely.
Lynette wants to know if she's on antidepressants, will she have to stop taking them for the procedure?
No. Really, the medications that we're concerned about people taking would be the blood thinners, because that's going to stop me from doing the procedure. Anything else, you know, your anxiety medication, your blood pressure medication, your cholesterol medication, none of that stuff really matters to the surgery, so you can continue taking most of those. But if you have some medical problems or something that you're worried about, again, get the consultation. That's where we discuss all those things. And we have to address your problem specifically because everyone's different. So anything that I say now may not be true for you. So don't take my word for any of this stuff. Which is why you may hear me speaking not only in this video but in other videos very vague about things, because the truth is that nobody's the same. So So there is no way to tell you, like for example, how much swelling you're going to have, how long is that going to last, how much bruising are you going to have, what's the recovery going to be like. None of those things can be answered because I don't know. There's variables, and
Okay.
each person is different.
They're asking, is her whole body numb?
No, it's just the area where. So we do local anesthetic. She said, "Yeah, her whole body's
feel
hurt."
Yeah, I can feel my arm.
No, so we numb only the area that we're treating. And one of the advantages of that is that afterwards she's going to be able to get up and walk around. And you can see, you saw before, she was smiling and she's happy and, you know, she's in a good mood.
Smile for us.
Yay!
A question was how many sessions can you treat at once? I think they meant areas. How many areas? And then is it more than one session? Does it need to do this more than once?
So this is a one-time treatment on the areas that we treat. So if you get like where she's getting treated now, she should never have to do this again. This should be permanent. Now with that said, there are people that get liposuction a second time. It's called revision liposuction. I do lots of those procedures. You know, when other doctors don't do good jobs, their patients come to me. What's that?
Well, they don't take enough out, right? I've heard girls
Yeah.
complain about that.
Right, so sometimes if they don't take enough fat out, the patients will be unhappy. So I do lots of those revisions on people, and we have to fix the problems that other doctors make. And so when you go to someone that is inexperienced and not comfortable with complex situations, they will err on the side of caution. And what does that mean? That means taking out less fat. Because their thought is that you can always take out more fat, but if you take out too much, it's hard to go backwards. So I like to make the right decision the first time and do it right the first time, so then you don't have to come back a second time to do it.
Someone asked, does the skin become loose?
Initially, right now, it becomes loose because I'm breaking up all the connective tissue, and the skin, when you leave here, is very loose and jiggly. But over the next few weeks, the body forms scar tissue, and the scar tissue kind of works like glue, and it sticks everything together. So, yeah, and you're going to wear your compression garment afterwards, which will keep everything tight. And so when the body forms the scar tissue, it'll tighten everything up in the position where the skin is held tight with the compression garment. But it's also dependent on the individual, because if you have loose skin before the procedure, it's different than a person that's got tight skin before the procedure. So you have to, take salt with a grain of salt. Some individuals have very tight skin, and afterwards the procedure goes extremely well. The skin tightens up nicely and is nice, smooth, and perfect afterwards. A lot of that has to do with the individual, and not as much with me. So when you're considering your results and you compare to other people, you have to be cognizant and aware that those other people may have different bodies than you. They may have different skin tone than you. So we're just doing the best that we can with each individual and trying to get them the best results. And most of the time, we get phenomenal results. Sometimes it doesn't work out the way we planned, and a lot of times that's because of the limitations that the individual has.
So someone said, Elizabeth Cuevas said, can you confirm this assumption? I guess that if you don't eat well, you can recover the fat in the treated areas. Does fat come back through the years?
So we're going to be removing upwards of 80 to 90% of the fat in this treated area. So when I say 80 to 90%, that means that there's still some fat left behind. So that fat left behind, that fat can grow. If you gain a substantial amount of weight, those fat cells will expand and they will get bigger. So theoretically, it is possible to gain weight back in this area. It's just going to be more difficult. You're going to have a harder time gaining the weight because there's a lot less fat cells.
Someone said, how are you up during this procedure?
Well, I got a good night's sleep.
Yeah, actually, I didn't sleep at all last night.
Yeah, I'm ready to roll. Thanks for asking.
Can you remove that from the armpit?
Yes. If you have fat, we can remove it.
Tink Lou says, please say hi to Tiff from me. Tink Lou.
Oh, tell her I said hello.
Say hello.
Hello.
They want to know how many puncture holes you typically do and how do they scar.
Yeah, so they're tiny. If you guys want to see the instrument that we use, so this is the instrument. You can see it's like a circular blade. It's called a punch, biopsy punch. They use these in dermatology to take out little skin tags and moles and things of that nature. So you can see it's very small. The instruments are a little bit thicker, so they stretch the skin, but the skin retracts back, so it works out pretty nice. I'm gonna come around this side now. So you want to just make sure we keep her in here, and she didn't really want people to know about it.
Yeah, I got it.
Oh, no, that's all okay.
We'll get you from here. We won't show it.
Take that off a little bit.
Here on MyShape Facebook.
Someone asked about having a major fat apron. She says that that's what she has. It's pretty saggy. It's filled with fat. How would I get rid of this if it'll just sag? I'm interested because I want the fat. I can't get gone, but I don't want to look nasty.
So that big apron that's hanging down, it's hanging down partly because of gravity. Gravity pulls it down. Now, if you have it full of fat, that's a hell of a lot heavier than when it's empty. So when it's full of fat, it's pulling down and it hangs further down. So just by removing the fat, it will inherently bounce back and be smaller, guaranteed. And always, 100% of the time, it gets smaller. So now you may have loose skin because you have excess skin. Those aprons, that part that folds over, we call it the pannus. Sometimes it goes away completely, and sometimes it's just substantially smaller. It's just going to depend on the individual and how big the problem was to begin with.
No, I've
We'll
never.
deal with them later.
Okay, they're back.
Sorry about that.
Yeah, that's weird. So we took a phone call in the middle of the procedure. Wow, live. Lots of firsts today.
What is the website?
I tagged it in the
It's tagged in there, ladies.
So, MyShapeLipo.com. MyShapeLipo.
MyShapeLipo.com.
Hey, if you, is that Facebook? I think you can type a comment and tag it.
Yeah.
I mean, pin it.
Yeah, we'll put your link in there.
How long you been doing this? Asked Bruce.
How long have I been doing this?
I'm not sure who he was talking to.
Okay, we've been at this procedure for about an hour and 20 minutes now. I've been doing liposuction for, I think it's been about 12 years now. Done well over 15,000 procedures. Quite a bit. So she just had a little bit of a pinching sensation here, which that occurs sometimes. We just put some more numbing medication and we're all good. No big deal. And I know most people are so scared about pain, and it's the fear of that pain that stops you from doing what you want to do. And you can see she's awake throughout this process. She's smiling.
I'm still smiling.
And when she feels a little bit of pain, she just lets me know, and
I'll just tap her on the shoulder.
yeah, I just put a little bit more numbing medication. It's not that big of a deal. But you have to keep in mind all that, to get you numb, we use a lot of fluids. We use a lot of this numbing medication. So when we put more of this numbing fluid in here, that stuff needs to come out. So the body will reabsorb it, but it takes a lot longer for the body to reabsorb it. So we want the fluids to be drained out. We want them to just come out naturally.
So I have a question from Solar.
Okay.
I'm 55 kilos. I think that I do not have fat actually, but all the fat goes to my belly. I'm not a fat girl, but my belly is the problem. Is that really dangerous doing this step, although I'm not a fat girl in general?
No, we're treating the abdomen right now. So it's entirely safe. The abdomen is the most popular procedure that we do. Your weight really has no difference, no bearing. We have people that are, I know you said kilos.
2.2.
Yeah, so that's pretty light.
120.
Yeah, so we have patients that are very, very light and get liposuction, and it's crazy because everyone else thinks that person is too skinny, but that individual, they feel the same way as really heavy people. So it's the way you see yourself, it's the perception. So from a health standpoint, from a medical standpoint, none of that stuff will make a difference. If you wanted to get liposuction and you were 100 pounds, you can get liposuction. And it's really just people judging you that I think you're going to be concerned about. But don't worry about it. Lots of people do it. Stop listening to other people.
Yeah, really.
He says, does that hurt? Why every time I watch a person getting lipo, they are knocked out?
Well, that's the old way to do it. And the funny thing is that there's still plastic surgeons, almost all plastic surgeons still do it the old way, where they put you to sleep. It's substantially more expensive because of general anesthesia. It has to be done in a hospital because it's a lot more dangerous. So you're right. Everyone else you see does it the old way, at least those that are showing it online. So this is the real deal here. This is the latest techniques of liposuction, how we can do it when the patients are awake. It's substantially cheaper, the recovery is a lot easier, and the results are phenomenal.
Heather Getty says the muscle on his right arm must be serious.
I use both arms, so.
I live with him, his arms are the same. Both of them are the same. What country is this happening in?
Oh, America.
America.
Only in America.
America. Just outside Las Vegas, Nevada.
So you don't have to go to Mexico. And you don't have to go to, where else do they go? Dominican Republic. Or Colombia. Where else? Brazil. Yeah.
Teresa asked, is this happening in a surgical suite?
Yes, we have 3 surgical suites here.
Can the fat below the C-section line or the fupa be liposuction?
Yes. Again, we can take fat from anywhere, wherever your problem is. That's where we can go to take it. I've done some weird things. Suck fat at some odd places on the body. So I have experience doing a lot of different things. You'll go talk to other surgeons and they will tell you that it's not possible. For example, I had a patient a couple months back that she came in, had one of her arms was fat. One of her forearms, and so we're talking about forearm, was fat. And I'd never actually sucked fat off of a forearm before. So it was kind of a new uncharted territory.
Someone's asking, do you do lipo on really heavy patients too, like 250 pounds?
Yes, we do. And a lot of other practices are going to limit the individuals and tell you that you have to lose weight. And I suck fat for a living, so I am not going to tell you to go lose fat. So there are no weight limits.
So Tim Hawley says, not enough alcohol on this planet. that could get me to do that. And then like 2 comments down, he says, well, maybe there's enough. You don't need alcohol, you just need some lidocaine. Is she awake? Yes, she's flipping around for us. Do men get this too?
Yes. Yeah.
Yes, ma'am. Yes, sir. Where are you at? We're in Henderson, Nevada, just outside Las Vegas. Can you take the fat from one place and add it to another with this type of procedure?
Yes, it's called fat transfer. So we typically will do that to the breast or to the butt, but again, fat can be put anywhere, it can be taken out of anywhere. So wherever your problem is, if you don't see a name for it on our website, just give us a call. Like I said, we can suck it out of anywhere. I heard some story that Kim Kardashian had liposuction on her toes.
I heard it too.
Yeah.
After she got pregnant, her feet swelled up.
Right. So that's weird. I've never done that before, but I'm sure I could.
Kaylee K is asking, what can you do for hip dips? No matter how much weight I lose, they won't go away.
Yeah, that's just genetics. We can fix that. That's really easy.
Easy fix, Kaylee. Again, we're in Henderson, Nevada, just outside Las Vegas. What's the weirdest place you've taken fat from, and what's the price on this procedure?
So I was just talking about I think the weirdest place that I've taken fat on was a single forearm. But we also do odd areas, be calves and ankles. That's not very common, but I've done lots of those. Where else have we taken fat out?
Random other question, do you have slot machines in there?
Wow.
No.
What?
That is
It's like
random.
the only place I haven't seen slot machines.
Right?
And do fat cells regenerate?
All the studies say fat cells don't regenerate, so once they're gone, they're gone. But we never remove 100% of the fat cells, so there's always going to be something left behind. So if you gain a substantial amount of weight after the procedure, it is possible to still gain weight. So it's still important. Diet and exercise will always be important the rest of your life, not only for loss of weight, but also for health. So if you want to live longer, you want to feel better, you want to be able to function and do the things that you want to do in life, you're going to have to diet and exercise. Eat healthy.
Dora is asking, is there a limit of surgical procedures after having 2 C-sections? If so, the incision done lower than the original scar line?
No, there's no limitation, and we don't make incisions like that. So this is not a tummy tuck. This is just liposuction. But the issues that you have with the C-section scar, you probably have where the skin folds over at the scar. That's pretty common, and the liposuction will resolve that issue by taking out the fat as well as breaking up the connective tissue that causes the puckering of the scar.
Can she be awake during fat transfer?
Yes. I think we're probably the only place in the country that does fat transfer while you're awake. I was at an international fat grafting conference, and every doctor there from all around the world said it was impossible. So I came home and did it. And I haven't told anybody, so fortunately I don't think my competitors watch these lives.
Price, please.
So it's $1,299, so $1,299 per area of liposuction, and then $2,000 for the fat transfer to the butt or the breast. Now, how many areas you're going to need will be individualized, so you need to set up your free consultation to figure out which areas you need to treat.
Emily messaged you, how's it going?
Isn't she on the live?
No, we're on Facebook. She's right, yes,
Oh,
right.
she
No,
didn't
we're on
have
Facebook,
She didn't
yeah.
have Facebook.
Doc, have you ever gotten lipo done on yourself?
I have. Is that hurting there? So when I first got started in liposuction, what's that? Don't worry about it.
Does this mess up your nerves in the areas that are done?
So it's possible, anytime you break through the skin, it's possible to affect the nerves. So when we're doing liposuction, it's always going to be possible that you may have some irregular sensations afterwards. You might have burning sensations. You might have numbing sensations. Typically, all that stuff goes away in time, but theoretically, it's possible to have permanent damage. But fortunately, you don't have to touch things with your belly. And if you have a decreased sensation on the areas that we treat, typically it's not as big of an issue. If you go to the bathroom? Okay. I'm almost done.
Don't rush.
Good point, no,
I just
you're
didn't
right.
know. I didn't know that word. I didn't ask that question before.
Looks amazing though.
Don't rush. Oh wait.
How many areas would this one be? How many areas is she treating?
So she's got upper abdomen, lower abdomen. And so we divided about the middle right here. Now some people will have the belly that folds over and the abdomen's elongated, so that would be considered the pannus. Some people are much larger. And so our areas are typically about the size of a hand. And we're very generous. And so when we say the size of a hand, it's a big hand. Okay?
It's a
Then
Trevor hand.
Then on the sides you have the love handles and the hips. And then she's treating the lower back, which goes all the way along the lower back. And that's the lower back shapes the butt and creates that arch.
So 5 areas total.
Correct.
5 areas total.
What's your pain level right now? Smiling.
It depends on how many
I just
areas
have
in
to
the back
finish.
you're treating. Some
gotta go to the
consider the back to be the lower
all she's
back, the
looking
love
for.
handles the hips. You could also treat the back brow roll, be more aggressive and treat more surface area.
Okay, you guys can see this. So at the end, I'm basically doing my quality control, and I'm just checking the thickness. So I can tell based on my pinch. When I pinch with my fingers, I can tell how thick the layer is underneath. So you'll see me going through this stuff, and I'm just feeling the thickness throughout, and I'm just trying to make sure that everything's uniform and equal. And if it's equal, then underneath it's even. And if it's even underneath, then theoretically the skin's gonna be nice and smooth. So that's my philosophy on how I do this stuff.
This is a very important question. Are your nurses beautiful? Yes. Hey.
You skipped one. Turn it around.
No, no.
Turn it around.
Okay, so we are
It's too
all
close.
done.
We'll go back live in a little bit.
We're all done. We're gonna take a break now, get her cleaned up, get the garments on, and then we'll be back for Emily's procedure in probably 20-30 minutes. So don't go far. This is gonna be a liposuction day. So spend your time with us. Any other questions, get your questions ready, and we'll be answering them next live. Meanwhile, we're gonna get cleaned up and get everything set. So thank you guys for watching. We do appreciate you.
Bye, guys.